Welcome to OncLive News Network. Today, we'll share important highlights from the 56th annual meeting of the American Society of Hematology in San Francisco. We'll hear about several studies in Hodgkin's lymphoma, developments in multiple myeloma, and promising advances in the treatment of AML, CLL, and pediatric ALL. All that and more starts right now on OncLive News Network. Hello and welcome. I'm Laura Jones. In Hodgkin lymphoma, promising results came out of several studies. First, in the Phase 1b KEYNOTE-013 trial, 66% of patients with classical Hodgkin's lymphoma had either a complete or partial response after receiving the immunotherapy drug pembrolizumab. According to Dr. Craig Moskowitz, lead investigator from Memorial Sloan Kettering Cancer Center, these results are quite extraordinary given the dire circumstances these patients were facing. The 29 patients in the study already failed to respond to the treatment with brentuximab vedotin, and 20 of these patients had also relapsed with autologous stem cell transplantation. The most common drug-related adverse effects were grade 1 or 2 respiratory problems and thyroid disorders. Already approved for patients with advanced melanoma, pembrolizumab acts as an inhibitor of PD-1, a protein on the surface of T cells that normally regulates the immune system by stopping T cell activation. Another PD-1 inhibitor, nivolumab, also demonstrated success in a Phase 1 trial of 23 patients with relapsed or refractory classical Hodgkin lymphoma. In this study, the objective response rate was 87%, with 4 patients achieving a complete response and 16 obtaining a partial response. The remaining 3 patients had stable disease. Among the 18 patients who had previously failed brentuximab, the objective response rate was 89%. All 23 patients had a reduction in tumor burden at 1 or more response assessments during the treatment period. Dr. Philippe Armand, lead investigator from the Dana-Farber Cancer Institute in Boston, emphasized these results, along with the pembrolizumab study, highlight the importance and the potential of the PD-1 pathway in the classical Hodgkin lymphoma. Based on these results, the FDA granted nivolumab breakthrough designation status in relapsed classical Hodgkin lymphoma. Currently, a large multinational Phase 2 trial of nivolumab is underway. Finally, Dr. Craig Moskowitz presented results from the first study in lymphoma to demonstrate that the addition of maintenance drug after transplant can markedly improve patient outcomes. The ATHERA trial was initiated to evaluate whether early treatment with brentuximab after transplant could prevent progression in patients with Hodgkin lymphoma. The randomized multicenter study compared brentuximab with placebo in 327 patients who had been treated with a minimum of 2 prior systemic therapies and faced a risk of post-transplant disease progression. After a median follow-up of 2 years, researchers found that 65% of patients receiving brentuximab were still experiencing progression-free survival, compared with 45% of patients receiving placebo. Dr. Moskowitz predicts that given these results, extremely positive results that is, maintenance of brentuximab will soon become the standard of care for patients with Hodgkin's lymphoma who undergo a stem cell transplant. Patients with multiple myeloma may also have some additional treatment options in the future. First, in the open-label ASPIRE study, 792 patients with relapsed multiple myeloma were treated with lenalidomide and dexamethasone and then randomized to receive either carfilzomib or placebo. The addition of carfilzomib resulted in statistically significant improvements. The median progressive-free survival, the trial's primary endpoint, was 26.3 months in carfilzomab arm versus 17.6 months with placebo. The objective response rate in the study arm was 87.1% versus 66.7% with placebo. 31.8% of patients on carfilzomab had a complete response compared with only 9.3% of patients on placebo. Beyond the demonstrated efficacy, Dr. Keith Stewart from Mayo Clinic in Scottsdale, Arizona, shared the noteworthy study finding that patients in the carfilzomab arm reported better global health status that persisted throughout the 18 months of the study. Two exciting studies demonstrated the effectiveness of anti-CD38 monoclonal antibody therapy in the treatment of multiple myeloma. In a phase 1b trial, the human IgG1K antibody daratumumab combined with 4 standard frontline therapies led to a dramatic improvement in outcomes without additional toxicity. According to Dr. Maria Victoria Mateos from Spain, one of the lead investigators, daratumumab was associated with high rates of response in combination with the different backbones. In 3 of the 4 treatment arms, overall response rate was 100%. In a separate phase 1b study, nearly 2/3 of patients with heavily pre-treated relapsed or refractory multiple myeloma responded to treatment with humanized IgG1 antibody SAR 650984 administered in combination with lenalidomide and dexamethasone. The most common treated-related adverse event experienced by at least 35% of patients were fatigue, nausea, upper respiratory tract infection. Dr. Thomas Martin, lead investigator from University of California, San Francisco, explains that anti-CD38 monoclonal antibodies are going to be tested in the front line in the early relapse patients and in multiple relapse patients. Several presentations reporting promising results in the setting of leukemia. For AML, the goal of treating patients with therapy targeted to the specific genotype of their disease took another step closer to reality. A small first-in-man study led by Dr. Eitan Stein of Memorial Sloan Kettering Cancer Center represents a new chemotherapy-free, genotypically driven approach to AML. The novel drug AG221, designed to target a mutation of the IDH2 gene, produced durable remissions in patients with AML. Among the 45 evaluable patients in this study, responses have been observed in 56%, including complete remission in 15 and partial remission in 10 patients. Mild side effects were thought to be non-treatment related. The most common severe adverse events included tumor lysis syndrome and leukocytosis, although leukocytosis appears to predict response since all the patients who experienced it went on to achieve complete or partial remission. Let's look at some enlightening data in the setting of CLL. As reported at ASCO 2013, the combination of adalimumab and rituximab in older treatment-naive patients with CLL and SLL resulted in an overall response rate of 97%. Beyond being used to reduce the increase of lymphocyte count observed with adalimumab, the role of rituximab in this regimen was not clear. To assess the need for rituximab, Dr. Andrew Zelenetz of Memorial Sloan Kettering Cancer Center led a study to examine efficacy and safety of adalimumab and monotherapy in this population. At the time of analysis, 38 patients completed 8 weeks of therapy. 47% had a partial response, and 40% had a partial response with lymphocytosis. Based on the analysis, Dr. Zelenetz explained that rituximab had nothing to do with the nodal response in the combination study. The researchers concluded that adalimumab, currently FDA approved for relapsed CLL and SLL, also had substantial single-agent activity as a frontline therapy. Finally, some wonderful news for children with ALL. The anti-CD19 chimeric antigen receptor modified T-cell therapy, CTL-019, received a breakthrough therapy designation from the FDA for its potential as a treatment for pediatric and adult patients with relapsed and refractory ALL, and now there's more data to back the FDA's decision. 92% of the 39 pediatric patients with relapsed and refractory ALL treated with CTL-019 achieved a complete response. The event-free survival was 70% and overall survival was 75%. Patients with low-level disease experienced an overall response rate of 100%. Still, even in patients with a large burden of disease, the overall response rate was 82%. At a median follow-up of 6 months, 76% of patients continued to respond to therapy. Lead investigator Dr. Stephen Grupp from the Children's Hospital of Philadelphia stressed that even though the median follow-up is 6 months, CTL-019 has produced durable remissions. He shares that 15 patients have continued responding for a year or more. All responding patients developed varying grades of cytokine release syndrome at peak T cell expansions. However, all cases responded rapidly to IL-6 targeted anti-cytokine treatment. And those are some of the key highlights from the American Society of Hematology 2014 meeting. And that'll do it for today. Thanks so much for watching OncLive News Network. I'm Laura Jones. We'll see you next time.